Hey guys, I got one here from Mercer.com, and this is titled California Individual Health Coverage Mandate Includes Employer Reporting. And to start this off, I was just doing a little research on the Affordable Care Act. So apparently, Covered California is something that was spawned underneath the Affordable Care Act, so the individual mandate came along with it. But it was repealed after the Tax Cuts and Jobs Act went through, where they repealed the individual mandate, which in effect repealed the individual mandate under Covered California. However, it sounds like the Californian state government has found a way to legislate it into effect. So it's been arisen from the dead, like Frankenstein, so to speak. So let me just take a sip of coffee here, and we'll jump into it. All right. California's new individual health insurance mandate, and this is 2009, Chapter 38, subsection 78, requires state residents to maintain minimum essential coverage (MEC) for themselves and their dependents starting on January 1st, 2020, or pay a state tax penalty. The legislation also establishes a 3-year program to provide additional state subsidies to help certain households purchase coverage through Covered California, the state's public exchange. California joins Massachusetts, New Jersey, Vermont, and the District of Columbia, which have similar mandates that aim to stabilize the individual health insurance market. While Massachusetts law predates the Affordable Care Act, other states took action after Congress zeroed out the Affordable Care Act's individual mandate penalty as of January 1st, 2019. And California individual mandate. The California law imposes a tax penalty described below on any state resident who fails to maintain MEC for themselves and their dependents, which includes spouses, dependent children, and registered domestic partners. The tax penalty for failing to maintain MEC won't apply to certain individuals whose premium contribution for healthcare exceeds 8.3% of their household income for the taxable year. And individuals who aren't required to file California income taxes don't have to maintain MEC. Additional exemptions apply to the following individuals for any month in which they failed to maintain MEC. Individuals who obtain a hardship exemption from the exchange, members of certain religious sects who obtain a religious conscience certificate of exemption, healthcare sharing ministry members, incarcerated individuals, non-U.S. citizens or nationals who are not lawfully present in the U.S., tribal members, certain expatriates, residents of another U.S. state or U.S. possession, and individuals enrolled in the limited scope coverage under Medi-Cal or other similar programs. Residents who don't fall into one of these categories may still avoid a penalty if their coverage lapse lasts than 3 months. And however, if the lack of coverage lasts longer, they will face a penalty for the full duration of the lapse. And MEC defined. The California MEC definition substantially mirrors the ACA definition of MEC. Enrollment in any of the following types of coverage will qualify as MEC under the California individual mandate. Employer-sponsored group health plans that cover more than just accepted benefits, such as accident or disability insurance, on-site medical clinics, separate dental or vision plans, workers' compensation policies, or long-term care insurance. Individual health policies that meet ACA's market requirements, certain government-sponsored programs, including Medicare, Medi-Cal, CHIP, CHIP that is, TRICARE, and similar programs. University of California student health insurance or other student health care plans and voluntary dependent plans. Limited scope, supplemental, hospital, and fixed indemnity, and certain other plans covering only accepted benefits won't qualify as MEC. The California Department of Health and Safety can add other types of MEC that are, quote, similar in form and substance, unquote, to coverages listed above. Reporting and notice requirements. Self-insured plans, plan sponsors health insurers. Let's read it. I'll take another sip of coffee. self-insured plan sponsors, health insurers, and other entities that provide MEC to residents must report to the California Franchise Tax Board, FTB, by March 31st of the year after close of coverage each year, or rather close of each coverage year. Additional notices may go to covered individuals and their dependents by January 31st after the coverage year ends. Failure to report this coverage can trigger penalties of $50 per affected individual per tax year. And notice forms, the FTB will develop a reporting form that includes the covered individuals and covered dependents' name, address, taxpayer identification number, and dates of MEC coverage during the calendar year. The FTB also will develop the notice to individuals. The FTB form may request additional data, but a form with the same information required by Section 655 of the Internal Revenue Code as of December 15th, 2017 will suffice for California reporting. This essentially means entities that provide coverage statements to individuals using IRS forms 1095A, 1095B, 1095C won't have to provide duplicate state notices unless IRS substantially changes those forms. Individual shared responsibility penalties. While the MEC standards and reporting requirements substantially mirror ACA provisions in effect as of December 15th, 2017, California residents who don't maintain MEC face a state-specific penalty. The penalty formula is complicated. The penalty will be tied to several factors, including the average cost of an area, bronze plan, and annually adjusted applicable dollar amount starting at $695 for adults and $347.50 for children, household size, and taxpayer income. Per an FTB bill analysis, the penalty is equal to the lesser of either of the following amounts. Number one, the sum of the monthly penalty amounts 4 months in the taxable year during which one or more failures occurred, an amount equal to 1/12 of the state average premium for qualified health plans that have a bronze level of coverage for the applicable household size involved and are offered through the exchange for plan years beginning in the calendar year with or within which the taxable year ends, multiplied by the number of months in which a failure occurred. And the analysis gives these additional instructions for calculating the penalty. For purposes of computing above, the monthly penalty amount for any month during which a failure occurred is equal to 1/12 of the greater of either of the following amounts. An amount equal to the lesser or lesser of either of the following. The sum of the applicable dollar amounts for all applicable household members who fail to enroll and maintain MEC during the month, unless they did not maintain MEC for a continuous period of 3 months or less. 300% of the applicable dollar amount determined for the calendar year during which the taxable year ends, and an amount equal to 2.5% of the excess of the responsible individual's applicable household income for the taxable year over the amount of gross income that would trigger the responsible individual's requirement to file a state income tax return based on the applicable filing threshold for the taxable year. There's a little bit left here. I'm just going to go ahead and buzz through it. Additional premium tax subsidies. California will supplement premium tax credits for health insurance purchased through Covered California, the state's public exchange. Under the ACA, individuals who earn less than 400% of the federal poverty line FPL qualify for federal premium tax credits. Beginning January 1st, 2020, California will provide additional premium subsidies to state residents who qualify for federal premium credits and earn between 400% and 600% of the FPL. This range equates to 2019 household income of approximately $50,000 to $75,000 for a single individual and $103,000 to $155,000 for a family of four. Funding and sunset. And funding and sunset. The state exchange will oversee designing the subsidy program using funds appropriated for the coverage year and earmarked for the program. The measure specifically notes that the subsidy is an entitlement and isn't intended to increase taxes. This suggests the state won't impose any assessment on insurers, third-party administrators, or employers to help fund subsidies. The program is scheduled to remain in effect until January 1st, 2023. No funding will be appropriated after 2022. Employer next steps. To prepare for the new law's implementation on January 1st, January 1st, 2020, that is, employers with employees in California should coordinate with their insurance carriers and self-insured medical plan vendors to stay informed about updates, including announcements and giving reporting details. Watch for guidance on employee notice and requirements, and in the absence of specific rules, consider informing affected employees about the mandate. And coordinate with ACA reporting vendors to ensure that you are prepared for the filings that will be due in the first quarter of 2021. And they have a couple of hyperlinks down here that they have a hyperlink to the actual bill that was passed June 27th, 2019. And okay, so look, here's the deal, guys. I think that the Affordable Care Act was one thing that was very unpopular all across the board. I think only the most sycophantic Obama supporters would defend it because they said, well, it's going to help poor people get health care. These people, they are literally so partisan that they will say that everything that Obama did was just absolutely golden. They don't care about the racial division, the bigoted rhetoric from him, the anti-Israel sentiment. They don't care about the expansion of the surveillance state. They don't care about the drone wars where, he killed as many people as Bush, if not more. Pardon me. They don't care about that, and they're willing to go to bat for this type of thing. They don't care if it hurts the individual taxpayer, because a lot of these people, they can afford health insurance. I, on the other hand, cannot, and I don't necessarily believe in it. I don't go to the doctor or anything like that. In fact, I consider this to be kind of a do not resuscitate tag in some ways. I don't have any fear of getting sick or dying or anything like that, so healthcare for me is completely irrelevant. But I'm thinking about the financial imposition that this may have on me, including not just me, but my friends and my family, those who can't afford it. It's pretty sad that people are willing to go to bat for this. But I do think that, kind of a white bill here, that a lot of people are waking up to the fact that the state of California is just completely trying to destroy the state and its people. And that's the reason why people are leaving in droves, because they say, hey, I don't want to live here anymore. There's just so many things going wrong. And when you have guys like Gavin Newsom going on Twitter and saying oh, happy 2020 everybody, and 2019 was such a great year for healthcare and gun control and all this stuff, it's like that doesn't resonate with the Californian people. California used to be a red state, and it's very sad that you just have all these boomers, like these mindless boomers, that are just going to bat for this type of thing. Anything else? I think this is pretty awful. There's not much else to say, guys. All right, guys. Thank you so much for watching. God bless. I'll see you later.